Now, before we start these exercises, it's important to understand what we're trying to do. We want to slowly overload the injured or weak muscles and the tendons in order to trigger an adaptation response so that they get stronger. If they get stronger, they're more able to deal with the daily tasks that we carry out, and we should get less pain and less discomfort as a result. If we put these injured tissues under too much load too quickly, then we could cause further aggravation and likely make the condition worse overall. You must listen to your body and adapt the exercises and daily activities accordingly. If not, then you can expect a very frustrating and ultimately unrewarding journey. We should expect to feel some discomfort during the exercises, but still able to carry them out with good technique. If the pain is unbearable, then we need to reduce the difficulty, so we're placing less of a load on the injured muscles and tendons. In other words, we need to make the exercise that little bit easier. If you're unable to do any of the exercises due to unbearable pain, then seek advice from the doctor or physical therapist that's actively involved in your case. It may be that other interventions are needed prior to starting the rehab program they've prescribed for you. If you haven't seen a doctor or therapist yet, then that's your first task. You must get a proper diagnosis first. The exercises we've covered here are meant for demonstration purposes only, in order to guide you through how to carry out the exercises correctly and give you an idea of how to sequence them so that you can progress a little bit more safely and a bit more confidently. As far as expectation of when you should have a good level of improvement or maybe get rid of the condition completely, that's a tricky one. I usually recommend the client to expect 12 months of home rehab exercises, especially if we're dealing with a long-standing condition. If it's a pure bursitis, then I would refer my client for a guided steroid injection prior to starting the rehabilitation phase. But let's take a look at the exercises. First of all, we're going to start with isometric abduction. This exercise can be done standing, sitting, or laying on your back. The knees should be slightly wider than the hips in order to reduce the amount of compression over the structures of the greater trochanter. Loop a belt around the thighs, positioned just above the kneecaps. Push both thighs against the belt for a few seconds with low effort at first in order to gauge how it feels. Remember, it shouldn't be unbearable, and keep in mind that our focus should be slight overload so that we can come back again and do these exercises either later in the day or certainly again tomorrow. This isn't some sort of high intensity workout and shouldn't be approached like that. Don't feel that you have to hold the tension in the band for any particular length of time. I say band, but it could be belt, or do any particular number of repetitions or sets either. That would be me putting my expectations on you without knowing the level that you're currently at. So my advice would be to undercook it first, set that low benchmark, and see how it feels that night or the next day. Now you can change the overall load on the body by changing the length of time that you hold each repetition, the amount of effort that you put into each repetition, the number of repetitions, and the amount of rest you allow between repetitions as well. Next, we have prone internal and external control exercise. Chronic long-standing pain can adversely affect the coordination and the control of the affected body part, in this case the hip. It can become inhibited due to pain, and over time clients report feeling like the hip doesn't quite belong to them or feel under their full control. So as well as strengthening the muscles around the hip and the tendons as well, we also need to improve our coordination and motor control as well. Now lay on your front with your knee bent to 90 degrees. And imagine that your lower leg is now a windscreen wiper on a slow setting, and move the leg as shown in the video. This is all about control, not speed, so nice, slow, controlled movements here, please. Move as far as the pain allows, and remember, mild discomfort's okay, unbearable pain is not. It's not brave to push through and work through unbearable pain. It's going to hold you back in the long term. Same principle applies as the previous exercise. Do this as often as you feel able, but build up slowly. If you feel very comfortable, you could also add some light ankle weights in order to increase the difficulty, but don't do that straight away. Give that quite a while to build up to that. We also have the bridge exercise. Now, this is a fantastic exercise for working those muscles around the hip, so all the gluteal muscles, but also the hamstrings as well. Now, because we don't know exactly where you'll be as far as your ability to do these exercises, we've again put it through into a structure like almost like a ladder. Okay, so we've got the very, very entry level, and then we're going to take you up one level at a time. So we're going to put examples of those exercises in just after I finish talking right now. The very first stage, before we even begin any exercise, is to make sure that we're able to consciously contract our gluteal muscles. So stand and dig a couple of fingers into each one of your butt cheeks. And then just in your own time, just contract those muscles and see if you can push your fingers away. If you're struggling to contract those muscles, then tense all of the muscles in your thigh at the same time, and you may find you're able to then. With practice and over time, you'll be able to relax the thigh and get a good contraction through the gluteal muscles. And then if you want to really push it, you can start to contract one side at a time. Lay on your back and bend your knees until your shins are at roughly 45 degrees to the floor. Place your arms by your side and keep your head on the floor looking straight up. Squeeze the muscles in your glutes and slowly raise your pelvis from the floor, counting 3 to 4 seconds up and 3 to 4 seconds down. Concentrate on moving the hips only. The lumbar region should stay still. So in other words, you shouldn't get any arching of your low back. You don't have to fully extend the hips, as long as you feel a good contraction in the glute muscles. If you feel any cramping or fatigue in your hamstrings, those muscles at the back of your thigh there, shuffle your feet closer to your buttocks to reduce the stress on those hamstring muscles. Start with as many repetitions as you feel able, but no more than 10. Same setup as for the glute bridge exercise, but one foot is closer to the buttocks, about 1 foot length closer. Concentrate on putting more weight through the foot closer to the buttock. Slowly up for 3 to 4 and down for 3 to 4 seconds. Again, no more than 10 repetitions for each leg. Same setup as the glute bridge here. Count 3 to 4 seconds up, hold, and slowly take the weight off 1 foot. You don't have to try taking the foot off the floor straight away though. In order to build up to this, you could move your body slightly to one side, so more weight is over 1 foot whilst in the hold position. Return to even weight bearing and then count 3 to 4 seconds down. Repeat this no more than 5 times, but focus on good quality rather than quantity. Here we have the same as for the hover bridge, but when you lift the foot, we now extend the leg. Keep the pelvis level, hold the position for no more than 5 seconds in the hold position, return the foot to the floor and lower for a count of 3 to 4 seconds. We can make this a little bit more difficult by lifting the pelvis up and down whilst keeping the legs straight and off the floor. Building up to single leg standing, we can lean towards the side and hold that position, making sure that the pelvis is held level. If you feel the pelvis is pushing out to one side, or the knee is starting to come across the body, which is what we call adduction if you saw the previous video, if this happens, then we must reduce the load. By leaning, we can lessen the jump from 2 legs standing to 1 leg standing. It's the hope that this gradual increase in load reduces the risk of overloading and injuring and aggravating your condition. With single leg standing, put a hand onto a stable surface for balance and take the hand away from the surface if you're comfortable to, and hold this position for as long as you can and hold the pelvis nice and level without the knee coming across your body. A useful tip can be to stand in front of the mirror so that you can see what's happening. You can see the position of your pelvis, you can see the position of your knee, and you can adjust your posture accordingly. The squat is a fantastic exercise as well. What we've done is we've looked at this exercise which works the thighs and the hips exceptionally well if done properly, and we've put it into a ladder format again, just like we did with the glute bridge, with rung number 1 being the easiest form of squat and rung 15 being a very difficult taxing type of squat. Now, all I want you to do is to find the level that suits you, and if in doubt, go a level or 2 down, because you can always build back up. What we don't want is for you to overcook it, aggravate your issue, and have to go back to a lesser exercise from here. So just take your time with it. We're going to put all 15 rungs in now, so you can find the rung that suits you best and then work from there. Take a broom handle or wooden pole and place it behind you. Make contact with your belt line, between your shoulder blades and the back of your head. When bending forwards, make sure the bar stays in contact with all 3 of those points. That way we know the movement is coming from your hips, not your spine. If we move incorrectly, we lose contact with the bar. Building on from the hip hinge, we squat so the thighs are above parallel with the floor. Only squat down as far as you feel comfortable. From the front, you can see the feet are about hip width apart, and you can use the arms as a counterbalance in front of you. Try and keep your feet flat on the floor throughout the movement. In rung 3, we're looking to get the thighs to parallel or lower. The feet are still flat on the floor and at hip width apart, but feel free to experiment with other stances to find what works best for you. Remember to adhere to the coaching points from the earlier rungs. The back should be straight, and from the front we're making sure that the knees track over the toes. Don't let the knees collapse inwards. Rung 4 is a slight modification of rung 2. The same rules apply, but we're going up onto our toes after completing the half squat. It challenges our balance as well as working the calf muscles. Keep the back straight, hinge from the hips, and make sure the knees are tracking over the toes during the squat, before pushing up onto our toes. Rung 5 is very similar to rung 4, but this time we're going up onto our toes after completing a full squat. As before, it challenges our balance as well as working the calf muscles, but keep the back straight, hinge from the hips, and make sure the knees are tracking over the toes. One foot is placed in front of the other with a very narrow stance. As you drop down, the front foot stays flat on the floor, whereas the back foot goes up onto the ball of the foot. It puts pressure on one leg more than the other, so make sure to swap the feet in order to work both legs evenly. It's a different technique to what we've done so far, but the fundamental rules remain the same. Keep the quality high and remember to regress the movement if it needs to be made any easier. Cross one foot over the other and drop down into a squat or crouching type position. Make sure to work both legs, so swap the feet over once you've completed your repetitions on one side. Now don't rush to progress. We want quality repetitions each time. Health doesn't have a finish line, so don't rush to move through the rungs too quickly. Rung 8 is very similar to rung 7, but this time we're going to go up on our toes at the end of the squat movement. This tests our balance, which hopefully we've worked on during the pre-squat ladder, but do feel free to go back there at any time in order to work on these foundation movement skills if they need improving. Make sure to swap the feet over, just like in squat rung 7, in order to work both legs evenly. The squat jump is the same as rung 5, except for instead of going up onto our toes, we propel ourselves off the floor with both feet and land on both feet. Try to make the landing as quiet as possible, and we can do this by dropping back into the squat position on landing. This time we do a normal squat jump, and then we land with a wide stance, squat with a wide stance and jump, landing in a narrow stance. We then repeat this as many times as is comfortable, but go slow at first to make sure that you're moving correctly. We're still jumping, but we're jumping forwards now. So we squat and jump forwards off 2 feet and land as quietly as possible on both feet. If you're restricted for space, you can jump forwards, land, and then just step back to your start position. And note that even on landing, we should be hitting that position of hip hinge with the back in a nice, straight, neutral position. And now we're jumping sideways. The rules are no different. The squat should be full, hinging at the hips, with the knees tracking over the toes. Accelerate upwards out of the squat, jumping either left or right. Use the arms as a counterbalance and try to land a bit quieter than I do. Single leg squats can be done 2 different ways, and you can choose to do either. This is a pistol squat, where you have the foot held in front of you. The fundamentals are the same, but the load on the squatting leg and the stabilising gluteal muscles is much greater. The other style, as you can see, is to trail the foot behind you. Just practice both and see which one you find most comfortable. Keep the quality high and don't try and progress too quickly. That's how injuries happen. In rung 14, we're not pausing at the bottom of the squat. We're going to keep it as one smooth motion. We'll try and get the thigh to parallel if possible, but this takes a lot of body control, leg strength, and they both take time to develop. So quality over quantity, and allow your body to adapt without being too overloaded at first. Rung 15 is the same as rung 14, but we finish up on our toes. Just keep the fundamentals the same. Use the wall for balance if you need to. And remember, we're just looking to progress slowly. You don't have to get it right straight away. Keep sticking at it and you'll get it done. The step-up exercise follows on from simple one-leg standing, but now we're going to step up onto a step, fun enough, but making sure the pelvis is level and the knee doesn't drift across our body. Make sure also the pelvis doesn't sway out to the side in that Trendelenburg type gait that we've seen before. Resistant band exercises can be useful, but again, we're being careful with this because the amount of compression. So if we're doing those, we want the knees to be wider than the hips. Just build up to these. These would be some of the more advanced exercises that I would put people in for. And I'll show you some examples of them right now. Place the band around your ankles or your knees, whichever you prefer. I'd recommend choosing a light resistance band at first, and you can always progress to a tougher band as you progress. Try and keep your walking gait as normal as possible and feel the gluteal muscles and the other muscles around the hips working against the resistance band. The final example is quite a taxing and difficult exercise. Therefore, please work through all the other exercises and become proficient in them first before moving on to this third example. All of these exercises don't have to be done in isolation from each other. Okay, for example, you can progress through the glute bridge ladder and the squat ladders parallel with each other. Just do what works best for you. Don't do everything, just pick a few things that seem to work and just build up from there, because nobody knows you better than you. But please put your questions and requests into the comments, and we look forward to seeing you in the next video. Take care, bye bye.